Welcome to Cups and Courage, the podcast. Today's guest is Saskia, and she was diagnosed in January 2025 with breast cancer. She's had a lumpectomy and radiation. Cups and Courage, the podcast. Welcome, Saskia.
Hello, thanks for having me.
No, you're so welcome. Thank you for joining us. We have a tradition at the beginning of our podcast that we ask all of our guests to bring in their favourite biscuit.
Yeah.
We try and guess.
Mm-hmm.
But I'm not going to guess. I'm just going to go for it, okay?
Go for it.
Let's have a go. What do we think? I thought you were a jammy dodger. I will share.
Okay.
I've gone with a jammy dodger as a prediction.
Okay. Now you can fill 45 minutes with that one.
Jaffa cake. Controversial.
Yes, I know. Some people say it's a biscuit, some people say it's a cake. So
Is Jaffa cake British? Do we know where the origins of Jaffa cake
I actually don't know. I haven't seen it in Germany where I'm from.
Right.
So I've only followed the debate in the UK whether it's a biscuit or a cake.
Yeah.
But we do cake in Germany and that ain't a cake. So it has to be a biscuit.
Brilliant. Love Jaffa cake.
I normally like them when they come from the fridge, so this is a little bit warm.
Okay.
But
yeah. Less than perfect, but perfect still.
Okay, good.
So Cups and Courage.
Uh-huh.
I will start by asking you, what does courage mean to you?
It's an interesting one. I think, I mean, I don't know, when you look this up, it says something like stuff you're afraid of doing and then you're doing it anyway. I think in this scenario, I think every day is being brave. Just the mundane little things. I don't think there's a real definition in the sense of what makes you brave. I think it's just living life and just no matter what comes, just living it. To me, that's bravery anyway. Yeah, just getting on with it. Yeah, exactly.
I love this word. I love the word.
Yeah.
But it's lots of people say different things, different versions. Some people talk about just keep going, keep moving forward and just getting on with it.
Yeah.
And just showing up, doing the thing, even if it's difficult.
Yes, exactly.
Yeah.
I think it is a bit like that, but sometimes in our situation, you don't really have a lot of choice. So, like often bravery is like, okay, I could choose not to do it and that be the safe option. Mm-hmm. And then by doing it, it's not the safe option and you have to be brave. In this case, I feel like there is no choice. So you have to do it anyway. So I don't feel particularly brave, but I think just by just living and sharing and going out, you're just doing it anyway.
Thank you. So I'm really interested to get right in it with you.
Mm-hmm.
I'm not going to ease you in gently here.
Go for it.
So obviously this is quite recent for you. This is the beginning of the year. Mm-hmm. And you found a lump.
I did.
And you were told you needed a lumpectomy.
That's right.
What was the conversation? In that space, were you given that as an option or was it very much directive? And talk me a little bit about that experience.
I mean, it was very matter of fact. And the diagnosis or just telling me in that room was very matter of fact. And which I think was good on the one hand because it didn't feel like it was this massive news, even though it was. But then it was giving two different options between a mastectomy and a lumpectomy. But I didn't feel like I had enough information given to me in terms of making a choice. I knew straight away what I wanted, but I didn't feel like there was enough follow-up information or not guidance, but information around either choice to say like, oh no, I'm definitely going to go for this. I'm definitely going to go for that. Didn't feel like that, but I certainly had a choice. Certainly felt like I had a choice.
Did you feel any kind of influence from the medical professionals around what they believed to be the better course of action?
Not in regards to surgery.
Okay.
I didn't feel there was any influence at all. When he said, my surgeon asked me, so what did you want to do? So I went away and then obviously came down to surgery. What do you want to do? And I felt almost like a little bit when I said lumpectomy, I felt almost like he should have said like, yeah, of course, because obviously that's, you have such a small lesion. Of course, that's what you do. But it didn't feel like he was trying to direct me at all.
That's a good thing.
Yeah, not for the surgery. Yeah.
Okay.
Mm-hmm.
That's right. And so how did you feel? Were you I sometimes talk about whether or not you're in the driving seat of those conversations or a passenger seat.
Yeah.
That sounds like it was fairly even. That was a two-way conversation between you and your surgeon around lumpectomy, although you would have liked to have a bit of validation that
Yes.
what you were
that I was making the right decision. So I think it was definitely, I felt I was in the driving seat, but I didn't feel like in the driving seat having enough information. I felt like I needed to go out and do my own research or do my own, like, you know, validating of my own choices.
Okay.
And there wasn't enough dialogue in between. I would have liked to have more discussion with my surgeon, just talking things through, you know, just like sitting down and having a chat like this. Just, I don't know, half an hour, a cup of coffee, okay, what's going on? But the human aspect obviously is missing quite heavily. So it's just the matter of fact, here are your two choices, go off, make a decision, come back, and that's it.
And literally, you didn't have any resources were you signposted anywhere to kind of think about these things? Or
I mean, I'm sure there was at the beginning. I'm sure someone mentioned something, but it was all a bit of a blur.
Yeah.
So I can't say for certain where they directed me to. I got obviously the leaflets and stuff, which is such superficial bits of information that I think it's a difficult one, because some people really seek out information. They need to know lots, and other people I just want someone to make that decision for me. So I think it's sometimes a bit difficult. But even if I had this very top level information, I would have preferred having like a clearer idea of where I can find more information.
Yeah. I found that I've had this pretty much the same consultant. Please eat the Jaffa cake. I had the same consultant most of my the process of mine, and mine was quite transactional and almost on a clock. Although I'm sure that they wouldn't like to know that, but it's so busy, you know. It's one in, one out. Just you know. And so for me, what I found was breast care nurses really plugged some of that gap in my experience to do you have everything you need? You know, was that your experience or?
It was, yeah. So the breast cancer nurse was great, Emma. So she was really good. But again, like I think I had such little contact throughout my whole journey with maybe one particular person. It never felt like a proper dialogue. It felt like, okay, there's certain stages of this journey, but it's very, very small, very few touch points with actually any clinical involvement. And I feel like 95% of the time you're just on your own and you just kind of like muddle your way through that somehow. So I found that even though the nurses are great for information, but a lot of it is not necessarily face-to-face, you know, like it's a phone call maybe, or like everyone deals with this differently. I prefer face-to-face conversations. I need that. There wasn't a lot of choice, and it felt more like, okay, so you're one of lots, because lots of us obviously are around, next. So it just felt like that, unfortunately. So the breast cancer nurses were great, but they're under stress as well, so you could just tell.
Not enough.
Not enough. No, not enough.
Was there any, you know, when you were looking at between mastectomy and lumpectomy, what was the thing that made you go lumpectomy over mastectomy?
I felt like I liked my boobs.
Okay.
I really did.
Yeah.
Well, it took me a long time to actually feel comfortable in my body and to love my body. Yeah. And I finally, over the last few years, felt like I'd taken more ownership. I really enjoy who I am, feel really confident and comfortable in myself. So there was I didn't want to lose that boob. I feel very attached to my boobs, so I didn't want to lose them. Yeah.
And also, if it's quite a small lesion, they wouldn't have offered a lumpectomy had it not been.
Yes, absolutely.
You know, so actually, I get that. Yeah. Okay. And then, so you've had the lumpectomy and then you're into radiation space.
That's right, yes.
So tell me what that was. Was that, how was that conversation had? Was there care? Did you have lots of information about what was going to happen?
There wasn't, again, there wasn't a huge amount, because again, the surgeon obviously doesn't necessarily want to step on the oncologist's toes. So you could tell he was trying to tell, my surgeon actually said to me, I only need like 5 days of whole breast treatment, because it's so small, they managed to get clear margins, it's all fine. There was tiny bit in a lymph node, but nothing major. They weren't too worried. And I was like, oh, this is great. And then I went to the oncologist and he said like, oh, you shouldn't have said that, because I think we need to have like a tumor bed booster. And I was like, okay, so maybe it's not as good as I thought it was, or maybe, you know, like there's more to worry about, or why. And then he was a little bit upset because, the surgeon shouldn't have said that. So there was a little bit of conflicting information on that side. I felt like, because I work in this field, I work in oncology, I feel like I know probably quite a bit already. So I wasn't as overwhelmed maybe as like someone else could be who's never in contact with this kind of
Saskia,
scenario.
just for an audience perspective, can you tell us what you do? What work
sure.
is for you?
I work for a medical device company, and we specialize in niche products for within oncology. So for patients with prostate cancer, pancreatic cancer, liver cancer. There was talk about some of our products being used for breast cancer as well. So it's what I do every day. Actually, before I came here today, I was supporting a case in Dublin. I wasn't in Dublin, but like over the phone for a liver patient. And so that's my everyday job. And now being on the other end is an interesting one. Mm-hmm.
Do you think that's influenced how you have handled this year?
Yeah, I think it's influenced in terms of filtering through a little bit more of the information that's out there, I think, and also understanding how healthcare professionals work sometimes. They all, as much as we can trust them, but as much as we want to trust their objective opinion, I think we have to realize they're all very biased. They're all very much trained in their field that they're working in. And it's interesting when I have these conversations with my consultants or the consultants I work with as well. They say, like, we're all biased. We all believe our own technology or the field I'm an expert in, that's the one that's the right thing for the patient. So I felt a little bit more removed and able to make a decision that's not necessarily just influenced on what they thought is the right thing. Yeah. So more like, for me, doesn't make it easier. It doesn't make it like, it doesn't mean I don't doubt myself or I don't doubt what the decision I'm taking, but it certainly puts a little bit of a perspective to these things. Yeah.
And so you've got this oncologist and a consultant who've given you slightly conflicting information. And for people that haven't been through this before, normally what we see is you have a consultant for your surgical pathway. Yeah. And then when you move into kind of oncology care, so radiation, any kind of chemotherapy, that sits with an oncologist. Yeah. So those are, because I remember wanting to have end-to-end information quite early on. So I'm a bit of an info, Yeah. I want to know all the information, but there was definitely limits that my consultant wouldn't talk to me about, similar to my oncologist, right? There are areas of their domain. Yes. But I have to say, I think I was quite lucky because there was lots of stuff in my case, but quite joined up. But yes. It sounds like yours weren't wholly joined up in terms of the information that you were getting.
No, it wasn't. It didn't feel like that at all. So, it just didn't. It didn't feel like completely separate entities. And I wonder whether, if you're in a room with all of them together would make more sense. I don't know, because I thought I'm going to see my surgeon all the way through. It's almost like someone, I just need someone to hold my hand or call me. How are you doing? And there's no one there. There's no one there. It's always like, if you need me, call me. But what about people who don't reach out, people who don't find that easy or anything? It's just like I don't know. I wish there was someone who would have a bit of an overview of everything and just guide you or hold your hand whilst you're going through this. I think that
consistency.
Would be... Yeah, consistency, absolutely.
At a point where there's so much overload of information, actually, from lots of different angles, to have that point of consistency. Yeah, I can see that. I can hear that.
Yeah, so I feel that's a major drawback, I think. And
so you then have your radiation.
Mm-hmm.
And talk to me about kind of was that something that the oncologist said, we absolutely encourage this, and the surgeon is also kind of verified, you're going to do this? Was there anything in your head that was going, I don't want to, I don't know if I want to do that?
Yeah, I wasn't sure about the radiation bit, I have to say, because in my head it made no sense. I thought, okay, so you cleared everything that was there, you can't see anything anymore, so radiation, surely the drawbacks or the long-term effects, how much do they outweigh actually the instant benefits? And the whole breast treatment, I could kind of get my head around, but then they were saying about this tumor bed booster, which is just because of my age, they said, and potentially obviously reoccurring, but it had no overall survival benefits. So you're like, okay, so I'm putting myself through an extra toxic treatment, and because again of my background, people with liver cancer, for example, they have that in the liver, which is more toxic. I appreciate that, but you just think, why am I putting my body through something that I might not need? And I was trying to get some answers or just have that conversation, but it felt like I was almost like a nuisance, or trying to get my oncologist to talk to him. I had to email 3 times. I couldn't get hold of anyone. And then eventually someone called, and then it was like, okay, so have you got any more questions? And I was like, I've got tons, but you put me
Take a seat.
you put me on the
It's
spot, and
hard.
how much time have I got? And you can just feel like the clock's ticking, and because I know, again, I'm feeling I work in this field, and you know how little time they have. But then on the other hand, when I speak with my consultants at work, I know how much they care, and I see how much they care. And they sometimes say I have sleepless nights because I don't know if I've treated the patient correctly. I'm worried about these things. So I have that, but I didn't feel it as a patient.
Isn't that interesting? That disparity.
Yeah.
This is a really unique viewpoint that you have. Because I can imagine that actually then you're continually going, well, this is my experience, but because you have got positive relations with oncologists where you know that it is having an impact, even though at a patient level, sometimes you think it isn't. Yeah,
absolutely. And that's the bit that I wasn't quite sure whether that is a unique experience to me, whether I don't know, the catchment area, I don't know. Whether it's the profession, again, I work with prostate cancer a lot. Maybe it's different. I don't know, but I feel like breast cancer is like, because so many people have it, it's almost like, oh yeah, next. What it's like? Oh, no, it's only breast cancer. It's not pancreatic cancer. You're not dying as such. So it's like next. And I have that with my personal, like my family and stuff as well. So it's almost like, well, you've had it. I mean, you've been diagnosed, you had your treatment. Can we all just move on, please?
Is that so? That's an experience that you're having, because it's also very recent, for you.
Mm-hmm.
So we're talking family-wise. They're just ready for you to kind of move on and business as usual.
Absolutely. And this whole trying to figure out where you fit in this world now. And as you I don't know, I said earlier, I spoke with someone about this process, and I hate that word as well. But it is really like figuring out where you fit in now. And it's whole grief about losing the person you were, and like embracing or finding your new person, whoever you are going to be now. But it's almost like your grief is not allowed, or it's not the same grief, because it's only breast cancer, and you only have stage 2, and it's only very small, and it hasn't spread. And because everyone says your prognosis is really good, but it doesn't take away any of the other fear that comes with it. And it's amazing how people have to go in this toxic positivity of trying to but this and this. It's like, but it's shit. It's shit. It's just shit. I didn't want this, even if it's just half a version of what you think might be horrible. And I really struggle with that. I really do. My mom is the worst for it. She's like, oh, but I'd be different. I'm really positive. And I just...
Cool, that's tough.
That's really tough. And then you just choose not to talk to her about stuff anymore. So it's difficult.
So your heritage is not British.
No, it's German, German, Austrian, yeah. Mm-hmm.
Right. So do you think that some of that is a cultural piece, or is this a personality? Is this an individual piece? I wonder.
I think both. I wouldn't say I have the biggest contacts there with my German countrymen. I've moved over here, so I have a bit of contacts there with family, obviously, and some friends. But I think there's definitely a tradition in Germany to believe everything the doctor says, especially the older generation, and then you just do everything they say, and then you're fine. So you don't have to worry about this. On top of that, then certainly the case for my mom. On top of that, then comes also her need for things to be okay. I could just tell she just needs me to be okay, because otherwise her whole worldview will just crumble. And I said, well, there's a small chance it might not be okay. I don't know until I have that MRI scan back, until I have the next scan. I don't know, but she just can't face that. And I think but we've done everything the doctor said, and they said it's going to be okay, so it has to be okay. So there cannot be this other option. And that's the battle for sure. And I think it's a cultural thing, maybe also a generational thing. And just not being able to face, just some really tough potential situations.
Other people in your life, how are they coping with I suppose this new world for you, right? Because it's process, whatever word we want to use, it's not a one and done situation, right? So it's figuring out the ebbs and flows of life after having a diagnosis. So, and I think my experience is other people quite like us to be well or not. It's quite binary. Oh, yeah,
Yes.
are you well or are you not well?
Yes, exactly. There's nothing in
We
between.
don't really know how to do the bit in between. And the bit in between is where you live.
Yeah,
right?
exactly.
And
It's
so
true.
I wonder how other people in your life, do you have that support, or is this a running theme throughout other relationships?
I actually found I've been incredibly lucky that I had a lot of support and a lot of like people who were just listening. That's all you want sometimes. I don't want a solution. There's none. There's like, because when people say, I don't know what you want me to say, I don't want you to say anything. Just like listen. So I felt I had that a lot, and I feel like I've done a lot of revamping of my life years before actually this has happened. So when some people try and find meaning in this and say, oh, now this is my opportunity to change everything around and do the things I want to do, I feel like I've done that. So I'm a bit lost in terms of, okay, how am I going to give this meaning? Because I feel like I've done all of this. But on the other hand, it's been an incredible blessing, because I feel like I have a really strong support system, and I have majority of people in my life, I just want them in my life. They're not like, I don't have to filter them out. So it's been really, really good. But I feel like with my mom, people very close to me, they struggle a little bit with seeing me upset when actually the signs for the future should be or seem positive, but they struggle. The closest ones struggle. Yeah, the rest is actually they've been really good, really supportive. So, but I feel like it's almost like, oh yeah, breast cancer next. So it's like, it's a bit. I like that as well at the same time, because you're not being put into this, oh my God, like you're dead or you're dying. So it's an odd one.
It's so personal, isn't it?
Yeah,
it's
is,
so personal,
yeah.
because sometimes we want to normalize things and just move on, and we don't want to focus on the thing that's been all encompassing or whatever, or that's pushed us to our, emotional limits. And sometimes we want someone to acknowledge how complicated it is.
Yes.
And so I do think it must be hard as well for other people who are watching us, who also, if they're quite solution focused as well, to hold space. What is this concept, of not being able to fix something? But I think that's really tricky.
Yeah.
It's so I think definitely for me, it's around being really mindful of who is in my life, and how much information I'm sharing at any given point, because it does change.
It does.
And so you've got to have people around you that are okay with those changing movements and can move with you fluidly.
Yeah, it's true. I think that's definitely an interesting one, because I mean, it's also for me obviously an interesting one. I can be absolutely fine in the morning and full of like energy, and then I have like, I don't know, I see one thing or one moment, it's like, oh my God, how am I going to cope with this? So it's like, sure. If I struggle with this, then obviously other people, they want me to be well. I appreciate that their struggle with being so helpless and not being able to do any of this must also be really hard. But then it's easier if I said to them as well, I need to know that you're struggling. It doesn't help if you're like telling me, oh, everything, I have no worries about you. Like you'll be fine. But okay. I'm sure you probably worry as well sometimes. And then we cry together. Like that's 10 times better than me crying and you're like, oh, you're good. And so, but I think it's them wanting to be strong for me and not wanting to show their fears and their worries, and not, again, them probably thinking they're not worthy of having those feelings and putting them on top of me. So it's all about like finding, it gives you incredible opportunity to be, really vulnerable and just filter out all of this rubbish that we often get hung up on. And it's just like, just to be human. And, but it's also, maybe that's also bravery, like I've been brave to let down your guard and actually show it all. Like, and that's a tough one sometimes.
That's seriously that's courageous. I think vulnerability is one of those big courage things. Yeah. Okay, let's take it back to. I'm really interested around this information. Mm-hmm. You as someone who was actually searching for more information.
Yes, I was. Yeah.
Okay, so you've had your radiation.
Yeah.
It's had a physical impact, so that radiation isn't kind to skin anyway. No. So regardless if your boob looks the same, might feel different, right, afterwards.
Yeah. Oh, definitely. Yeah.
And now, where are you at from a treatment perspective? Have they left you be, or are you on any kind of pathway for an additional medicine from tamoxifen or other drugs like that? Where are you at?
So I was meant to take tamoxifen from basically after I had my surgery. That was the discussion, not from the point of diagnosis, but afterwards. I haven't taken it yet. I just can't get my head around it. I don't know if I want to start. I felt really good before my diagnosis. I feel really comfortable in my body. I for whatever reason, my mind and everything's just saying, I don't want to take it. So I've got a follow-up appointment with my oncologist at the end of July. That's the only other appointment I've got in my diary, to be fair. So I finished my treatment and that's it. So I got a little cream and a little leaflet afterwards and saying like, call us if you need us. And that was it. So I had quite a strong reaction to the tumor bed booster, and it like got blisters. And so it was quite sore. And my GP, I have to say, it's been amazing. That is probably the one that is the most consistent and the one I felt has shown the most care. Because when I first got my lump, I went there, he kind of told me off on it coming sooner. So I waited a few months, I have to admit. And then he called me and said, like, when after diagnosis, I went back in and he apologized, and he was more traumatized than me because he was so surprised he didn't expect that. So it was quite a nice bonding.
Humans being human, regardless of what coat you're wearing.
Absolutely. It was really nice. And then he called me with the obviously with the inflammation and the soreness after the radiation. And I felt like he took real time and asked me how I was doing. And so I felt like he was since my procedure or since my diagnosis, I felt like he's been the most consistent person in this journey, which is lovely on that side. But it's not someone who can give you input, because they're just on the surface level. So they can't,
not specialist within the cancer space.
No. So my next step would be obviously to discuss tamoxifen if I want to take that. I don't know. I don't know. And then just a follow up once a year apparently. But then I spoke with my friend in Germany who's been was diagnosed literally 2 weeks after me, and we've been going through this at the same time. And she had a similar diagnosis, like different kind of cancer, but same stage and stuff. And her treatment is like she's going to be being scanned every 3 months. So it's like, because they're worried about like recurrence, I'm going to be every month. I'm going to have a mammogram, which didn't even detect it in the first round. So what's the point of that? She's having full CT scans. So I don't know. It's all very confusing.
Does that it's a tricky one, isn't it? Because in one space, you've got a peer who you can go through something together and you can go, wow, it's not just me. And you can have that sense of connection, which is vital, I think, if you're going through anything that's difficult. But then on the other side, you go, you've got all of this. You've got access to all of this continuity and care and vigilance, monitoring, and it can highlight the absence.
Yeah, absolutely. I don't know which one I prefer. Like if I have it once a year, I don't have to worry about it too much. It's just this one date a year where I might be like, oh my God, freaking out. Every 3 months, I don't know how well I'd be coping with that. I don't know. It's hard because does it give you more reassurance? Surely, but does it also maybe make you think like, oh, it's more serious than it needs to be? Is it more serious? Are they not telling me the whole story? I don't know. I think it's an individual one as well. Again, it'd be nice if there was, a choice for some people who might not want to do it every year. They might want it 6 months. But I get it. Like NHS is overrun and stuff's hard. So, but I can't see how, when there's clear evidence that my cancer wasn't picked up, and that kind of cancer doesn't necessarily get picked up that easily on mammograms, how that screening is useful,
right?
At all. And I actually spoke to my oncologist about that, and he said, yeah, I understand, I know what you mean, and there's now some evidence that MRI actually for that particular cancer would be better, but there's no funding and there's not enough evidence to change that. So
you're left to go. You've got an appointment at the end of July. You're going to be discussing the tamoxifen piece. And we already know from experience, that there will be a real maybe not, because I don't know your oncologist, but there might be a bit of a gear towards taking tamoxifen.
He's actually been quite good, I have to say, and the surgeon as well. They both said, like, I can see why you wouldn't want to take it because of the quality of life that can be impacted. They also said that I have a very small chance of reoccurrence. It's obviously not zero, like with anything, but again, it's just a number. I did get another opinion, like through my connections with work. And he was dead on, like, tamoxifen, you have to take it. But then I also know he does research in that area, So he works with pharma, he works with this kind of stuff. So, of course, his bias is different.
Right.
I appreciate that. So it's, but then if I speak with, for example, consultants within prostate cancer, where you could probably have, like, if you have breast cancer, prostate cancer, it's probably, like if you have swap one for the other, you could kind of put them on the same level. And men kind of like, they don't want to take hormones because of the quality of life. So it's not even discussed. It's very rare that you do hormone therapy, or only if like there's no other options. And I was like, why is everyone shoving this down my throat? Like, why is like, there's not even like a discussion about half a dose or a little bit, or it's just the blanket for everyone. It's like, well, how does that work? I don't understand. And then on the other hand, there's nothing. So, so that one I struggle with, I have to say.
And I know we shared this before anyway, but so I was in a similar situation, but I said, no, I'm not going to take too much. When I've had too much, I'm not going to do it. And then, a couple of recurrences later and things changed significantly. But when I did start taking it, and it wasn't for a huge amount of time, but I had the same conversation. I said, why are we taking 20 milligrams? Because why? Yeah. Where, that's quite old data. I'm not in the field. So, I'm not a layman, but I don't have that same level of medical understanding and acumen. But I just wanted some evidence as to why we're still at 20 milligrams when not everybody in the world is. And I couldn't get any kind of clarity. And so I decided myself, I chopped my pills in half and I'm going to take 10 milligrams a day.
Yeah.
And, part of my personality is to stick proverbial fingers up when you tell me what to do and not why. But
I get that.
But I think it is about where we can sometimes claw back a sense of control or agency.
Yeah.
At a time where it's full of ambiguity and uncertainty. And actually, on top of that, you're getting conflicting messages from varying sources.
Yes, absolutely.
That's very tricky.
It's very hard.
And I don't know about you, but AI wasn't what it was when I was going through everything, and that's almost, I'm not sure if that's a great thing or not. And I know we're going slightly off topic, but the amount I use ChatGPT to ask questions, to centralize a lot of that research, but I think it is, as you spoke about, being able to have that face-to-face conversation with a human, a knowledgeable human who is a bit able to move their bias. Yeah. Because we all have it. Yeah. Be aware of how much of that bias is influencing any kind of conversation and not being able to hear the other person holistically. Yes. And what's important to them and otherwise. Yeah. I wanted just to touch on, you mentioned, I love my boobs. I left my boobs. I like my boobs. I've come a long way to, I've come this far to come this far. Yeah. How's your relationship with your body now? Has cancer, I'm doubling up with that question, has a diagnosis of cancer, subsequent treatment, impacted the relationship you have with your body now?
Funnily enough, it hasn't. But I don't know whether that is because my scar is literally sitting on the side. I don't see it. If I look in the mirror, I don't see it all the time. I have obviously tiny tattoos, but they don't bother me. What bothers me is that my boob's now hurting and it's not the same. It doesn't feel the same way as it used to.
From radiation? From
radiation, yes. It's a little bit bigger. It's like, it could just, I don't know, it's just have a day where it feels more normal, a day where it doesn't feel the same. And I think that is just a little bit annoyance, but not with my body, just with doing something that I didn't want to do and I did it anyway, and now my poor boob has to pay the price for it. But I have no hate towards my boob or my body for having cancer or anything like that. So I don't feel like that at all. I'm glad I could keep them because I like her. So I don't want to lose her if I don't have to. But I've been very lucky. I have a partner who's incredibly supportive and who's is like, hasn't throughout this whole thing not treated me any different, which is really lovely on that side. So I feel like I have a very healthy relationship with my body. So feel very lucky on that side. But whether that's going to change, going forward, I don't know how this radiation is going to change my boob going forward. How if it's, I don't know, going to shrink it suddenly or it's going to be scarring on it. I don't know. So it's just the uncertainty a little bit. But at the moment, I feel like I'm doing good.
These are great questions to be able to ask oncology, actually, at that point, different aspects, because it's full of questions. And when we don't have that close connection with someone to ask those questions as they come up.
Yeah, absolutely. I mean, again, they will always say like, oh, we don't know. It could be this, it could potentially be that. Because to be frank, they don't know. And I go to these oncology conferences and they, for example, go through medication to treat something and they're like, oh, well, we think it could be, it might be, they often don't know. And they only follow like guidance or guidelines with NICE and stuff. So just because obviously someone has enough evidence, and again, what's the evidence level that you need to get? You know, it's like all of these things come into this, and they can't tell you like, don't take it, because based on what's recommended, they have to tell you this. So it's so these questions you want to ask, and you can ask them, but again, I think it's just they don't know. They don't know.
What would your if you had to stand up in front of a room of oncologists and surgeons, say medical professionals, you know, within the breast cancer world, and you had 3 minutes, you know, and they were all really quiet.
Yeah.
So, you know, what would you say? What would you like to say?
I think what I'd want them to do is to listen to each other more and understand actually each other's point of view, and have like a more of a holistic approach as a group towards a patient. Because I think that sometimes, yes, you do, obviously they're tumor boards and they talk to each other, but I think it's sometimes the lack of having an open mind to other things. I think it's just that, even if it's not like me going, you know, I'm suddenly taking herbs and that's going to cure me. It's just like, okay, well, I'm a surgeon, I believe in surgery, but maybe radiologist has a different approach to this. So, okay, maybe I could at least in my other patients, I could say to them, okay, I believe in surgery, but you might also have this option or this option, just to be less biased and a bit more open to other areas as well. I think
Outside
that would, I think that'd be really useful.
That's interesting. Okay, and one final question. I know this is still quite recent, so I know where you are in the I'm trying to think of a different word, not journey or process or path, or you understand what I mean.
Yeah.
So it may change, but what would you say to your pre-cancer self?
Oh God, what would I say to her? I probably just enjoy, like, you know, the lightness, just enjoy life's not that difficult. Just enjoy not having any worries, because like once you have that, that's all gone. That's a different story. I think that's what I would
make
tell
the
her.
most of
Make the most of just the lightness and not having anything heavy to carry with you every day. I think that's...
It's hard, as they say, youth is wasted on the young.
Yes, it is pretty much like the non-knowing is wasted on me.
Okay, and then, sorry, I know that was, I said final question, but somebody who is very newly diagnosed, okay, have you got any words of wisdom or kind of a guiding, like, final note or anything that you'd pass on?
That's a hard one. I think it's a difficult one, because everyone's so unique and so different. I sometimes feel like because I have different background, it's hard. I would probably just say just to breathe and not worry. You're not going to die straight away. I think that's just breathe. There's time to look at stuff a little bit and digest it, and don't feel like you have to rush any decisions. Just to slow down a bit, and you're going to be fine. That's
great. Because actually sometimes we feel like there's not enough time, and we're made to feel like there's not enough time, depending, and sometimes things are very time sensitive, for sure, but there's always time to breathe, and there's always time to ask a question. Saskia, thank you. I've really enjoyed this conversation. It's been lovely, genuinely. Is it, you know, really insightful, and I've loved spending some time with you. And thank you for bringing Jaffa cakes. Biscuits. Thank you, Saskia.
Thank you very much. Thank you.
Cups and Courage shares honest, personal stories of people affected by breast cancer. The views you hear are those of the guests and host and don't replace medical advice. If you're concerned about your health, please speak to a doctor or healthcare team. Cups and Courage, the podcast.